Hi, I'm Kirby. I'm a pediatric physician assistant working here at Pathway, and today I wanted to talk about the ER. So when should you go to the ER? We have a previous video that we've done before listing common reasons why you should or shouldn't go to the ER, but just to go through a few that are pretty common is if we have a fever for greater than 5 days, if we have a fever that will not resolve with Tylenol or Motrin, or if we have a history of fever-related seizures and we have a seizure related to a fever, if your child is vomiting or if they have diarrhea and they're not able to keep liquids or solids in their system, broken bones where you can see the exposed bone or muscle, if we have any seizure-like activity where your child becomes unconscious and they're not responsive, definitely take them to the ER. Most ERs, excluding Children's of Alabama, will have several patients in the waiting room. You can expect a pretty lengthy wait because there are people with varying types of emergencies and varying statuses. Another thing to expect is to be brought back to get things like your temperature, your blood pressure, any medications that your child is taking, and then you usually go sit back in the waiting room for some time, and then they will call you back for further treatment and testing. You should definitely follow up with your primary care provider after going to the ER, regardless of the situation. Between 2 and 4 days after your ER visit, or maybe sooner, depending on what you take your child to the ER for, we definitely want to see you back to review why you went to the ER, any medications you were prescribed, and any continuing care. Depending on where you live, it may actually be faster to drive your child to the ER, but one important distinguishing factor is that if your child is unable to breathe or remain conscious, you have to call 911. Never transport your child to the ER if they've stopped breathing, if they've turned blue in the face, or if they are unable to breathe on their own. There are lots of other scenarios where you may or may not take your child to the ER. You can use our patient portal to ask questions. That's a wonderful resource that you can chat with our nurse about specifically whether you should or shouldn't, or whether you can wait to be seen, or if it's a true emergency and you need to go to the emergency room right then. Anytime you have to go to the ER, it is never a pleasant experience because your child is sick. But at the end of the day, we want them to get better. And if we believe we can't provide the care and treatment that your child needs, and we think it is important enough to go to the ER, then we definitely want you to receive the care that your child needs in the proper setting.